The global nursing shortage and low retention rates have been a well-recognized issue over the years. The pandemic has exacerbated the issue as healthcare institutions struggle to hire and retain their nursing staff. Causes of the shortage before the pandemic were due to an inadequate workforce planning and allocation mechanisms, resource-constrained undersupply of new staff, poor recruitment, retention, and return policies, and ineffective use of available nursing resources through inappropriate skill mix and utilization, poor incentive structures, and inadequate career support. Low retention rates in nursing are often caused by excessive amounts of turnover in the profession. It is believed that low retention rates or high turnover rates can be attributed to external attractions, unsuitable working conditions, and personal reasons. The inability to retain nurses has led to a shortage of nurses across the globe. The World Health Organization and the International Council of Nurses and Nursing Now states there is a global shortage of 5.9 million. It's critical that governments act now to reduce the risk of increased turnover among nurses and improve nurse retention. Policies can change the culture surrounding the nurse profession, empowering nurses to feel valued and respected. Registered nurses are an essential staple in healthcare and may be incentivized to continue their career if adequate and appropriate policies are established. It's important that solutions to this problem be proposed and implemented. Policies that offer support packages should be instated to registered nurses, both novice and expert. Packages should include benefits offering psychosocial therapy, opportunities to advance in the workplace, tuition assistance to further education, and flexible self-scheduling to allow for a healthy work-life balance. Safe staffing ratios by specialty and acuity should be instated for the safety of both the nurse and the patient to reduce errors and increase the quality of care delivered. Adequate break time should be included and mandatory, with a designated nurse to monitor patients during breaks for safety reasons. Pay increases should be instated to reflect inflation rates. Years of RN experience should be considered when increasing salaries, and crisis pay should be administered when dealing with an epidemic or pandemic such as COVID-19. In response to the pandemic, some countries have tried to recruit more nurses and prevent others from leaving their jobs or leaving the profession altogether. They have improved working conditions and encouraged nurses to return to the profession and increase the number of nursing students in training. To implement and develop policies, registered nurses must become a part of this process. They should continue to fight for change and provide feedback to determine the changes made will be successful in the long term. Models for health workforce planning that consider the need and demand for nursing services must be put into place. Nurses should be at the center of all efforts when rebuilding the system in such a way to fix the issue of the global nursing shortage and low retention rates.